Assalamualaikum warahmatullahi wabarakatuh. My name is Raja Muhammad Faris bin Raja Azhari. I'm from JBA 2425D, and let's start with the presentation. Depression is a mood disorder that involves a persistent feeling of sadness and loss of interest. It is different from the mood fluctuations that people regularly experience as a part of life. Major life events such as bereavement or the loss of a job can lead to trusted source depression. However, doctors only consider feelings of grief to be part of depression if they persist. Depression is an ongoing problem, not a passing one. It consists of episodes during which the symptoms can last for several weeks, months, or even worse, years. The user of group that I choose is the adult that have mental health problem. This is because depression is likely to be suffered by those who have huge responsibilities in life and they fail to fulfill it that led them to be depressed and no longer have the wills to live. The adults that have problems to speak up about their anxiety and life problems, and the adult that want to manage their feelings of depression are those who we want to help them living a better life. First of all, we need to identify the main causes and problems that led to depression among adults. There are plenty of causes and problems that are identified. One of the main causes is likely because of the family history. Some of the user might experience a bad tragedy from the past when they were children that make them easily become terrified or experience disturbing mental stress. Other than that, physical illness or injuries can also have a significant impact on their mental health. Next, the cause is highly because of their own personalities. Some people and personalities are just more apt to experience depression. For example, if someone was born to be quiet, they likely will experience depression because most of the time they are alone and they have no one to talk about their feeling. Then the problem of the user persona is they are clueless to manage their feelings. They experience problems of unable to control their emotions that led their responses to be disruptive or inappropriate. The next problem is they don't have the gut to talk openly about their feeling. The desire for them to share about their depression can be suppressed by the feelings of shame or concern about how others would react. We will proceed with the existing IT applications that are created in order to help these user personas. The first application is Mood Mission. This application is research-backed and it gives the user mission to help them improve their mood and mental health skills. This way, the user will fill their time doing the mission in the application and help them to release their stress and tension. There are plenty of activities and missions provided, such as emotion-based activities like reading exercise, behavior-based activities like learning how to knit or sew, physical activities such as push-ups, thought-based activities such as learning how to reframe negative thoughts. The next application is TalkSpace. This application connects the user to a wide network of mental health professionals and is well known across the board. TalkSpace therapists have all completed over 3,000 hours of clinical training and have been properly trained to deliver online treatment. There are cognitive behavioral therapy, existential humanistic approach, dialectical behavioral therapy, psychodynamic therapy, and mindfulness therapy. The advantages of Mood Mission is this application is developed by mental health professionals. Second one is it is supported by randomized controlled trials. There is also in-application rewards to increase motivation. The last one is evidence-based CBT activities for depression and anxiety. For TalkSpace, the user can have a conversation to talk to a licensed mental health professional. The therapist can diagnose and treat different conditions, and the user can have numerous ways to communicate with the therapist without having to worry about the conversation because it is all private and secure. But there are some limitations in both of the applications. The initial questionnaire in Mood Mission can be overwhelming. It might be too difficult for the user to answer. It does not include access to professional help. Other than that, some of the activity options may be time-consuming or difficult, and the application need to be subscribed and pay monthly for the service. For TalkSpace, it is not appropriate for severe mental health issues. Furthermore, therapist communication styles may not suit the user's needs, and therapist evaluation service can be aggravating. Lastly, the price is more expensive than some other applications. For the last slide, I will brainstorm about Mode Vision application. I find it that there are several improvements that can be done on this application. For replace, it should make an easy interface so the user knows how to use this application. Other than that, add notification alert for user to claim rewards daily so that user can become addicted and interested with the application. And the application can also add features like a chatbot so the user can comfortably talk with the robot about their feelings without needing to be ashamed about themselves. For Combine, the application should combine with AIA Malaysia, which the user can seek insurance to cover for depression. Next, the application should integrate it with professional therapists or counselor so the user can have a sharing session about their problems with their own personal therapist. Apart from that, the application should link with many other associates that offer online counseling to improve the performance of the application and make it more effective for the user. There is nothing to be removed or separate for this application as every features in this application contribute to the efficiency of this application. Lastly, the developer should reduce the subscribing price of the application to make it cheaper and help those depressed adults, giving them their normal life back. That is all from me. Thank you.